Welcome. Now, so far we have done some things about medical education, some circulatory system and nervous system and making mind maps. We have also taken about drug interactions during the medical practice. We have also seen differential diagnosis and we have also seen how to find possible treatments using ChatGPT. Now, let us continue our discussion. This time, suppose we want to give a high level examination, say USMLE or something. Now, I don't want to create sensation over here unnecessarily. Otherwise, you have heard those kind of news that ChatGPT has passed in USMLE or Harvard bar examination or maybe a difficult MBA examination and all that. But I really liked one particular reaction that actually does not tell about ChatGPT or its abilities or its risk also, but that tells about our education system and our examination system. And if ChatGPT and other LLMs and developments in AI continue, and I will one explain in one another some lecture that it is now the ball has been set rolling and it is difficult to stop it. So they will continue. Then we should radically transform the way we teach our kids and the way we evaluate them. Uh, our education system should put a less and less emphasis on the content or the um, what you say the corpus of knowledge and more emphasis on creativity and the consciousness and the ability to arrive at solutions, that is problem solving abilities, because content keeps on changing, but the technique of learning that will remain the same. Okay, enough of lectures. So now this let us take disease pathogenesis. Suppose you are giving an entrance exam for maybe MD pathology, and let us say that type of question asked: what are the stages of cancer development and what factors contributing to the progression of cancer? Now, this is pathogenesis, how cancer slowly develops in our body. And you can see that initiation and promotion and progression, and finally the metastasis stage, which is the usually what you call last stage of cancer. Okay, and usually we say that now it is incurable. Uh, then this it is also listing not only the stages, but it is also listing which factors affect during this four stages of progression, that genetic mutations and environment and lifestyle and chronic inflammation, hormonal factors and immune system, and all those things affect the various stages of progression, these four stages. Okay. So reasonably good answer, of course, not good enough, not at all good enough for MD pathology examination or medicine examination. But you always know that ChatGPT is a generalized tool. There are AI based tools which are exclusively trained on medical corpus. And second thing, knowledge of medical textbooks. And the second thing is even ChatGPT, you can stretch it limits. For example, I can ask that take one particular point here, and I can tell it that. further clarify this immune system dysfunction, or further clarify how genetic mutation contributes to the progression of cancer. So there is no limit to going ahead with ChatGPT. Okay. Now let me take other case. Say cancer is one big killer in India. Similarly, this is diabetes, and it is another big killer in India. So, what is the pathogenesis of diabetes and how does it lead to the development of the disease? How diabetes comes into the picture? Then, type 1 diabetes, it's basically an autoimmune disease. Okay. While type 2 diabetes, it is a metabolic disorder and it is characterized by insulin resistance and impaired insulin secretion. Okay. Now, these things are enough for a layman at least to make himself familiar with the thing which he has, and to make a more meaningful conversation with the doctor, because the doctors are quite busy often, and howsoever they try, because of prolonged practice, a few what you call jargon type of words that are specific to medical profession, they inadvertently uh, come into the conversation. So at that time, as a patient, one should be knowing that what is the meaning of impaired insulin and all that. So hyperglycemia and hypoglycemia and all that. So this is a useful tool for education, not for treatment. Again, I'm warning. Alzheimer is again another worldwide health issue. So we are asking what is the pathogenesis of Alzheimer disease, and it is giving this long answer. Okay, and then last is what is the pathogenesis of jaundice. In India, still uh, millions of kids die because of jaundice. So if maybe a primary healthcare worker, and to my mind a primary healthcare worker or the medical assistant would benefit the most from tools like ChatGPT, and of course the patient, provided he has the discipline of not to do self treatment, then here it can give the overview of what is the pathogenesis, how jaundice actually step by step develops. Okay. First, bilirubin production is excessive, then impaired bilirubin uptake, and then all these things. Then it fact which these are the factors which contribute to the development. So, if somebody is having jaundice, it is not a primary disease. Sometimes there is an underlying condition, maybe hepatitis or cirrhosis and alcoholism and maybe bile problem, infection, some blood disorders are there. So it is always good to know as a patient or as a medical assistant uh, this information. Okay. Now, in next lecture, we will talk about pharmacology.